Open up the meeting of the Department Valley Healthcare District, the regular session. Before we open up and have a roll call, I'd like to make a motion to excuse the absence for Director Pimentel. Can I get a second? Second. Fill out this.
Director Gallagher?
Yes.
Director Smith?
Yes.
Director Cox? Yes. Chairman Yang?
Yes. Rosie, whenever you're ready, we can get a roll call.
Yep.
Let's a roll call.
Director Gallagher?
Yes.
Director Smith?
Yeah.
Director Cox? Here. Chairman Yang?
Here. So as a reminder, you know, these meetings are publicly broadcast via Zoom. Even in the case that the public is not physically present, please consider that participants may be virtual and the meeting is recorded and posted for public viewing. We have no closed session for tonight for the Potter Valley Healthcare District. We do have one agenda modification for consideration. I'd like to ask that for a modification on item number 3 on the consent calendar, that it be receive and file and not for approval, as approval is not needed for item 3.
And I would like to pull number 4 or
Right, is there a second for that agenda modification?
yeah, can we pull number 4?
Yeah, I think let's have a vote first on item number 3, and then we can
Okay, I move approval of that motion for the change of item 3.
second.
Director Gallagher?
Yes.
Director Smith?
Yes.
Director Cox? Yes. And Chairman Yang?
Yes, okay, and so we'll do public comment first and then we'll come back to consent calendar and we can elect. Rosie, any raised hands for public comment on items not on tonight's agenda?
No hands on mic.
You please,
First of all, my name is Antonio Rivas, and member of the community, and also part of the senior legislature in Sacramento. I'm a board member too, and also part of the mental health commission. So first of all, I want to really thank you, hospital, for, in a sense, serving our mental health, the youth, the mental health services here in Washington. And I understand that during the process, I have 3 shifts, morning and the afternoon, in the process of hiring some people so they can be able to take care of the 3rd shift. So to help our youth and in relation to mental health. So I thank you for doing that kind of, providing that service to our community. And the second one is that it is important to me to let you know that in regards to our senior citizens and the elderly, is that we need to provide a little more services and resources. The most important thing that I see now is that when a senior citizen, has surgery or they have some type of illness and send them home, sometimes you need to provide some support or resources to that senior citizen. And I know a long time ago you have Prime Health. A long time ago you have that program, and which a nurse will go to the home and make sure that everything is going well. And I hope you can bring that up, bring it somehow and provide that service to that particularly the elderly. And also, I mean, the children and the people that sometimes they have some complications, people that, the children, they have some complications and they go home and sometimes they need to provide more guidance, more support, and any medical concerns that they have that family. So maybe in the future, as you go through the process of funding, that kind of stuff. So I hope you could be able to bring that program back. I know very well that program because, my wife did that, when he was working at the hospital here for 25 years before. And he was a pediatric nurse and he worked all the areas in this hospital. But he has to retire, she has to retire. So I hopefully, you can be able to bring that out because I think I see more of that as I visit our Washington Senior Center and in different areas. As I work in the community, I see some, some concern in regards to they need some support at home. And that it can be come to the hospital because the transportation or any other costs. So I hopefully that you can be able to provide that type of, support and help and for elderly and to the youth too. So I think because there's sometimes, they need that extra help to go to their homes and provide that concern and maybe, they could be able to give them some guidance on how to help, the child or the elderly in regards to that medical procedures that I have done.
Thank you.
Okay, that's all I can. Thank you.
Any other people wishing to speak on items not on the agenda? Okay, seeing no raised hands online either, I'll close down the public comment and ask that we make a motion, or if there's a second, to entertain Director Tavantes' motion to pull item number 4. Second? Yeah.
Director Fox,
Yes.
Director Fox. Yes, Attorney Newsom.
Yes. Okay, so that item will now become item number 7.
I'm sorry. Okay, never mind. I'll do it.
Okay, and so now we'll
What number will be?
suppose it'll be 7.
7.1?
7.1.
Okay.
Still refer to them by their numbers up here. We'll
Okay.
reflect in the minutes. Correct.
Any questions for staff of any of the 7 items or now 6 items on the consent calendar? Okay, I'll open up to public comment for any comments on the consent calendar. Seeing none online. Any first? No, I'll close down the public comment and entertain a motion for the consent calendar. With the understanding that number 3 is just a receive and file. Move approval.
Second. Director Gallagher.
Yes.
Yes.
Director Fox. Yep, Attorney Newsom.
Yes. Okay, item number 4.
I pulled it. I pulled it because since that didn't happen at the previous meeting, this item wouldn't make any sense.
Very smart.
So that's the only reason I pulled it. So that's my discussion. It's not appropriate today based on the previous meeting.
Would you like to make a motion to table the item or to?
I would
Next meeting?
may I make a motion that this item come back when the bylaws come back?
The hospital bylaws. Yeah.
Thank you. That's my motion.
Is there a second?
I'll second. Director Gallagher.
Yes.
Director Fox.
Yes.
Director Fox. Yep, Attorney Newsom.
Yes. Okay, we'll now move on to item number 8, and that is the Coastal Health Partners update from Lupe Mendoza.
So for those of you who have not met Lupe Mendoza, she is our executive director for Coastal Healthcare, which is our clinic. She's going to give the board an update on what the clinic has been up to and some of the metrics that we're looking at. Thanks, Lupe.
Introduction.
Yeah.
So I'm here to talk about the clinic, district clinic. Was recently we had a clinic name change from Coastal Health Partners to Coastal Healthcare. And I'll talk a little bit about that throughout the slides. What has not changed is our mission to continue to identify healthcare needs in Santa Cruz County as well as the surrounding communities, providing quality healthcare in a caring and safe environment for our patients and for. So prior to the district's acquisition of Baltimore Community Hospital's business and operations in 2022, what we had was Coastal Health Partners, a independent professional corporation who was the legal provider of care and also held the payer contracts as well as leases to the locations where we provided services to our patients. We also were group was managed by Boston Healthcare Management, which was a management service organization. And that management service organization was part of the bankruptcy that the hospital went through. So we needed to shift things over to the new district clinic. So what we have today is the newly organized district clinic close to healthcare. It's authorized under 1260 of the California Health and Safety Code. So now we are owned and operated by the district, similar to medical foundations such as Dignity or PAMP, where they're able to contract directly with individual physicians or groups. In this case, what we have today is a direct exclusive contract with Coast Healthcare Partners. So that sounded easy, but it wasn't. There was a giant restructuring effort that took place, and the list of items to do was enormous. Here we have just a few to give you kind of an idea of all the work that it took to move from Coastal Health Partners, a professional corporation, to the district clinic, Coastal Health Partners. To start off, some of the top items were applying and obtaining a Medicare and Medicaid provider ID number, which is an enormous effort, very lengthy process. Of course, CLIA certificates, new business license, new leases for these spaces where we're providing services. And one of the also very lengthy process was obtaining new payer contracts with all commercial insurances. We took advantage of having to establish these contracts as well as negotiate better rates. And here we have the new corporate structure. So all of that work that we didn't go live with the Coastal Healthcare until March 1st, 2024. So here we have Upper Valley Healthcare District with the district clinic right in the middle of it because the district is the clinic, it's a division of the district. We have Upper Valley Healthcare District Hospital Corporation listed up here because all of the support staff that supports the clinic are Boston Community Hospital employees who are leased to the district to provide support in the day-to-day operations of the clinics. Down below, we have Coastal Health Partners, as I said earlier. The district has a exclusive PSA agreement with Coastal Health Partners to provide services to our patients. Organization and management, here we have again Upper Valley Health District at the top. The board of directors ourselves, and then Steve Gray, our CEO, and I report to Steve. Down below, under me, we have Sandra Hamilton Clark. She's our billing supervisor, credentialing specialist, and many other things. She wears many hats. And Elvira Quintana, clinic supervisor. Other than these two employees, we only have an additional 9 employees, and these are medical assistants, front office personnel, and billing specialists. So we're a very small, mighty team. And so there's work to be done because we run so lean with our staff. There's things that are very dated, policies, old systems, things that require our focus, but it also requires investment and improvements. Off to the right, you see Dr. Dixit. You're probably wondering who that is. And Dr. Dixit is the president and owner of Coastal Health Partners. And the reason he's on here is because we have a consulting agreement with Dr. Dixit to provide support only in those items that pertain to the agreement that we have between the district and Coastal Health Partners. Locations. So here we have our locations. We have 2 locations here on campus. We have general surgery, bariatrics, nephrology, cardiology in the medical office building here at Escobedo Hospital. Off-site over at the Northwest Shopping Center on Main Street, we have our off-site location, and there we provide urology, ortho, spine, and podiatry lines of service. And coming soon, primary care. We'll be talking more about that in future slides, but we will have a primary care location over on Airport Boulevard. This is the location where a physician who has been in the area for many years, over 30 years, my understanding, Dr. Rocco is currently at. Here's a roster of our physicians. We have a total of 10 physicians, 9 are employee physicians, and 1 is a contracted physician. Anywhere the services that we provide, specialties are nephrology, cardiology, GI, general surgery, bariatrics, urology, podiatry, and again, ortho and spine. What you don't see up here is a couple of lines of service that we offer through Coastal Healthcare, and these are hospital-based services only that we provide to the hospital, and those are infectious disease and pulmonary critical care. Those are also through the clinic. Here we wanted to give you just a quick snapshot of our financial performance. It's very high level. And so what we have here is net loss favorable to budget at 16.3% overall. We also wanted to show you a little bit about our growth. And what we have here is patient growth from January to July of 2023, and then the same between January and July of 2024. And as you can see, we've had significant growth, which is great, 28%. And most of this growth can be attributed to the addition of GI services as well as podiatry. Strategic analysis. So some of the challenges that we face, we're in a competitive market. We are competing with Common Spirit, Kaiser, some of these large systems, and we all understand and know that we lack primary care. We don't have the base that we need to refer to our own specialists within Coastal Healthcare. Most of the referrals that our clinics get these days are from the county clinics, the ED, and from our physicians providing health services at the hospital. It's recruitment. Recruitment is challenging. Not only are we in somewhat of a rural area, but also cost of living. A lot of the candidates that we speak to are super interested until they find out how expensive it is to live here. And sometimes that drives them away. Payer environment, as I said earlier, prior to the reorganization, Coastal Health Partners have not had their payer contracts looked at since 2013, since it began. So they're very dated, very below market. And so we took this as an opportunity not only to establish new contracts under the new district clinic, but also to negotiate better rates. And we're happy to report that we were able to negotiate at least 50% more in reimbursement rates from our commercial carriers. Most of you have probably seen this slide here. I thought it was important to include it. It's part of the multiple community hospital strategic PowerPoint presentation. And the reason why we haven't decided to add this here is because we just wanted to once again to show how aligned we are in what we believe is needed. And that is recruiting and retaining high quality physicians to provide services here at our hospital and in our clinics. I want to draw your attention to just one other item, and that is the timeline. The timeline to recruit family physicians targeting the later half of 2025. And as I mentioned earlier with that new location, and we'll talk about a little bit more, we have a physician who is waiting for a signature for its employment agreement, and that will put us ahead of schedule with one of our major targets to recruit primary care because it's so needed. Priorities.
This is in addition to Dr. Rabago. This is an additional new
So
primary care.
Dr. Rollins is the one that would be joining us hopefully by the end of the year.
Yeah.
And so that will put us ahead of schedule.
I see.
It does say there are 2 positions, and that is still our goal. So as soon as we add Dr. Rabago, we believe that it will make it easier for us to recruit physicians into an established practice versus starting from scratch.
Gotcha.
And so hopefully we'll still meet that milestone of 2 positions by.
And this building has the space.
Yeah.
And the building is, it's big, it's got the space for the growth that we need and plan for. Here's some strategic priorities ranging from 2024 to 2026. Some of them we're working on, some of them we're talking about, some of them we are going to explore. And I'll just mention a few. So we, again, primary care development is super important to both the hospital and the clinics, the community and the patients that we serve. So some of the things that we're looking at is improving our recruitment packages. So that we're more in line with what other systems are offering. Maybe increasing, we're adding some bonus or evaluating our current benefits. And actually that is something that we're working on with HR now, looking at how we can improve our benefits and 401k plans and things like that. Perhaps partnering with physicians who are in the area already and are nearing retirement, just like Dr. Roldo, who's been in the community for so long, and who may be interested in partnering or considering partnering with us to help them through that transition. And so under internal restructuring, maybe looking at other models versus what we have now with Coastal Health Partners, which is so dated, you know, friendly PC. It's not what everyone else is doing these days. They're doing there's shareholder type of offers for physicians. There's a culture of accountability amongst their peers and physician leadership structure. And so peer and providers relations, so continuing to work, again, like I said earlier, contracts haven't been looked at since 2013. That can't happen. We've got to stay proactive and looking at agreements and fair contracts so that we are getting paid what we should be getting paid, as well as continuing to build our relationships with Central California Alliance for Health and Southern Federal Hand, who are such important partners in our community. We're currently already working on some partnerships with Southern Federal Land. I'll give an example. They are looking to expand specialty services in their clinics, so they turn to us for that, and we at this time have both cardiology and podiatric services being provided by our physicians in their Southern Federal Land clinics once or twice a month, and it's working out very well for us. Recent growth and recruitment. So Dr. Luke B is one of our newest additions. He joined us in June of 2023, providing GI services. At the time when he joined us, the hospital had 0 GI coverage. So his partnership with us and joining was a great addition, and been received very well. And he is doing thriving in our office, getting more referrals than we can handle. So we continue to that is one of the specialties that we're recruiting for, because there is a high need, huge need in this community. Dr. Blunt, podiatry, again, that's another service line that did not have any coverage here in the hospital. And so Dr. Blunt joined us in October of 2023. She's fairly new to us, and she's one of the physicians who's providing services over at Salud Bella. We're trying to get her as busy as we can. She's also providing services at Waltham Nursing Centers, providing pediatric care there. Dr. Fred Ralco is the physician again who will be hopefully signing on contract here really soon, and we will also acquire his beautiful large office space to grow our primary care line of service. And again, the specialty that we continue to recruit for are urology, GI, and primary care. So this slide is a little extra, but again, the success of Waltham Community Hospital is dependent on having robust medical staff and a primary care base, primary care physicians to support the hospital, support our clinics, increase referrals within, and again, talking about exploring ideas about new practice models that can be more attractive to the candidates that we are trying to recruit into our clinics. And again, this can be done, but it's going to require a lot of work and investment. And that is all.
Any questions? For open up for public comment. I think I have some comments. thank you so much for this presentation. And I'll save the comments that will come back from, for public comment, but, the only question I had was, are we going to, oh man, it just left my brain. Oh, are we going to, change the name of the primary care practice to align with Coastal Healthcare or with Watsonville Community Hospital or?
It's gonna be under the same name, Coastal Health.
Okay. So,
It's not gonna change, it's gonna be part of the same group.
so we'll have like new marketing materials on the outside of the building so people can identify it as a part of Watsonville Community Hospital.
Yes, so, the office will be rebranded with our logo, Coastal Healthcare,
Mhm.
and definitely some first marketing dollars.
Great.
And,
And we've still got some work to do on making sure that the community understands that they're all together.
Yeah.
That we're coastal healthcare and the hospital and district are together, so that's, we're working on that.
Fresh coat of paint would be nice, match the blue that we have here, so anyways.
yeah, that would be.
Yeah, okay, I'll open up for public comment now. Any raised hands online, Rosie?
Don't
No?
have a
Anyone wishing to speak? No? I know we're dying to get out of here, but I just wanna.
I'm sorry.
No,
But I
thank you,
promise.
it was
It
awesome.
was the first one, so the next one, I promise will be a lot shorter.
I hope twice as long, because we have a bunch of things to announce at the next one, hopefully. But I just want to thank you for the presentation, and I was at a data share presentation for seniors of all things with Antonio Rivas, the gentleman who spoke earlier. And I was put into a subgroup of that was called Reimagining Health for Seniors. And the number one thing that came up was primary care. Is how can we, not just in South County, but primary care physicians, how can we recruit throughout the entire county to bring more primary care physicians? And so it's a huge issue, not just here in South County, but obviously throughout Santa Cruz County. And so I'm really happy. I know Steve's got some great ideas that we're working on to improve that. So just thank you, and anything that the board can do to help continue to develop that primary care base. I mean, and specialty care as well too. Just, please do not hesitate to ask.
Spread the word.
Yeah,
There might be even physicians already in the community who are, maybe they're not happy with their current situation, employer, and we're open to talking to any candidates, any potential candidates. But yeah, there's a huge need for primary care, definitely. And so we hope to be able to help with some of the needs that
that's fantastic. Yeah, and I love the strategy of going to some of the folks who have been providers here for decades and then having that smooth transition for them and having that practice be grandfathered into our practice.
yeah, instead of leaving the area.
Exactly.
We have good physicians who might be considering leaving the area, so why not stay where they're needed?
Any other comments for closing today?
I got two more. One is just to thank Lupe. I mean, she went through those first couple of slides relatively quickly,
Yeah.
but it was like a ton of work. Like those first like 3 slides, the amount of work that she and her team and Sandy and everybody else have put into making all of the required legal changes and legal name changes and new NPI numbers and new contracts and all of that. It was a ton of work. So I want to thank you for doing that. I also want to recognize Cecilia Montalvo. I see her name there on the screen. She's on the phone. She's been our consultant who's been helping Lupe and the team with a lot of that work. So thank you to Cecilia for that.
Help.
For that
And do
work.
this without her.
Yeah. So I just wanted to say those 2 things.
Thanks.
And thanks, Lupe. Great job.
Thank you.
Thank you. Nice presentation. Thank you.
Okay, so that brings us to the end of the board meeting, so I'll turn today. Oh, we have one more. All right.
Which way down vote?
Okay. Do I have to make a motion to reopen the meeting?
No.
Okay, no, item number 9, the Powder Valley Healthcare District bylaw approval.
So I guess I'll ask Dr. Cox, is the Med Exec Committee looking at the district bylaws too, or just the hospital bylaws
No, the district bylaws as well.
as well? So we probably have the same motion and
Yeah.
conversation.
Yeah.
Second.
The question, the request, it sounds like from the board is to, let's do it all at once
Yeah.
instead of do
Yeah.
these now. and
Give
then
them the-
NEC ones later.
Give them the extended opportunity to comment.
Okay, so I guess there's a You'll have to.
You have to make the motion to,
table it until you get NBC comments.
Move to table it?
yeah.
Yeah.
Second.
Someone has, you made the motion, Marcelo?
Yeah, make the motion to table the item.
Director Gallagher?
Yes.
Constance?
Yes,
Director Fox? Yeah. Attorney Newsom?
Yes, okay.
Now.
Thank you, everyone. Good night.
Thank you very much.
thank you.